so I'm Annie Goyanes, the program coordinator for Parkinson Association of the Rockies. Welcome to the first session of a three-part series, PD 101 for the newly diagnosed. In the handout section, I have attached the other dates for PD 101, and there's also a community resource there for the newly diagnosed that's very beneficial. And we also have a handout promoting our E3 conference on Saturday, September 10th. That is in person and virtually. We'll be having a variety of speakers that focuses on the theme of healthy habits and PD. And today, Cari will be leading this first session. And I really encourage for the next two sessions to try and attend in person, as it can be more engaging and interacting with the group. And for questions, Cari, in the middle of her presentation, will stop and ask for questions. And you can either raise your hand or you can ask a question in the question box. And then I'll moderate the questions from there. And if you raise your hand, I'll be able to unmute you. So from there, Cari can take it away. And yeah.
Okay, great. Hi, everybody. I'm Cari Friedman. I'm the social worker, patient family service director for the Parkinson's Association of the Rockies. I've been with them since 1999, so in September it'll be 23 years. I love what I do, and so one of the main issues that I work with people is when they're newly diagnosed with Parkinson's, and that's why we're doing the PD 101 to educate you about what is Parkinson's. So here's my information. I'm the presenter, and this is the office number 303-830-1839. And I am there on Mondays, and I answer the information referral line Monday to Friday from 9 to 4. And the number is 303-861-1810. So I'm happy to help you with questions and that sort of thing. Okay, next. Okay, so you've been diagnosed with Parkinson's. Now what? So I guess that there's lots of questions that you must have about what you do with Parkinson's, and I'm going to help you through this journey that you did not choose to be on. Okay, so next slide, please. Okay, so you're going in the right direction. You've been diagnosed with a disease that's incurable and progressive, but it's not a death sentence. So what I mean by that is not curable yet. So there's some words that I'm going to use that are short words, YET, and if, that come up a lot. And so with Parkinson's, it is progressive, it's incurable, but it's not a death sentence. So we're going to give you some tools to prevent you from having different issues with Parkinson's. So I will go over all this stuff, and then you may not remember it, but I'm happy to help afterwards. And one theme that I'm going to give to you that I want you to remember throughout this talk is that you're going to be okay. Okay, you can use the two letters okay. And okay, what does that mean for each person? It's different, but we will help you with different tools so that you can go through this journey without having major problems. Okay, so next slide, please. Okay, so what is Parkinson's? A lot of people don't know. They go to the doctor and they say you have Parkinson's. And a lot of people, they leave their doctor's office and they've been there for about 10-15 minutes. The doctor tells you you have Parkinson's, and if it's your primary care doctor, and we'll go over different doctors as we go along. But what does that mean that you have this? And it impairs movement disorder is what it is. Parkinson's is a movement disorder, and it impairs your balance for most people, not everybody, coordination for some, slow movement, and leads to tremors and stiffness of the limbs. It's caused by degenerative generation of dopamine producing cells in specific parts of the brain. I'm going to go over all this in more detail as we go along. So there's a lot of information that I'm going to be throwing at you, but I'm going to break it down for you. So this is basically what Parkinson's is. It's a movement disorder that can impair your balance and coordination and can slow movement. And some people get tremors, some don't. Like I said before, there's stiffness of your limbs, and it can be called rigidity. And I'm going to repeat this stuff so that you can hear it from what I'm saying. Okay, so next slide, please. Okay, so what is Parkinson's? So I said that it's caused by degeneration of dopamine, which are producing cells in specific parts of the brain. Dopamine, we all have dopamine in our brain in different areas of the brain. There's some that helps with fight or flight. So if you walk to go across the street and a car comes in front of you, you pull back real quick. So when there's danger, your body reacts to keep you safe. There's another part of dopamine that is deep in the brain. It's in the substantia nigra. That's where dopamine is produced for movement. And we'll go into more detail about that. I'm just telling you what Parkinson's is, and then I'll explain further. So I'm giving you a lot of information, and we'll repeat it so you understand. Now, it's not contagious. It's not curable yet. It's not normal for older people. So if you go to your doctor and you're older, meaning you're over 70, and they say, well, it's just because you're old. Your balance is off because you're old. That's not a reason to have balance problems. And it's not impossible for younger people to get Parkinson's. And younger people what the definition of that is 60 and younger are young onset. And it's not a reason when you're diagnosed, there's not a reason for you to make immediate life-changing decisions. So it's not a death sentence, and you don't have to change your will or do everything like that right away. You've got lots of years ahead of you. Okay, next slide, please. So now I'm going to give you definitions of Parkinson's, and then I'm going to go into more detail of what Parkinson's is. So when you go to the doctor and they say you're a PWP, that means you're a person with Parkinson's. So I tend to say you're a person, and I don't say that you are Parkinson's. Okay, so I don't want you to look at yourself as Parkinson's. And when you're newly diagnosed, you think, oh my gosh, that's all I am is Parkinson's. That's not true. Right now you put yourself under a microscope, and so if you were to trip over a rug in your home that might have been curled a little bit, it may not be because of Parkinson's. It may be that you tripped over it because the way it was up a little bit and you fell over that. Or if you're walking in unleveled the sidewalk, and normally you wouldn't have a problem with that, but for some reason with the winters and all that, it tends to be unlevel anymore, and so you might trip over that. That may not be because of Parkinson's. So right now, because you're newly diagnosed, you're going to think that everything is related to Parkinson's. It's not. You have motor symptoms. So those are physical symptoms of Parkinson's, and I'll go into more detail. Right now, it's just terminology. And then there's non-motor symptoms. Those are things that aren't physical movement. So could be memory issues, a smell, that sort of thing. We'll go into that. Dopamine. So that's the compound that's present in your body as a neurotransmitter, and it controls movement and mood. So it's chemically involved in your body. Movement disorder specialists, those are neurologists who have training and specific to movement disorders, including Parkinson's. So if you go to we'll talk about this, when you go to your general doctor, your PCP, primary care provider, and they say, oh, I think you have Parkinson's, you need to go see a neurologist. So, well, when you have a neurologist, a general neurologist, they can handle working with people with Parkinson's. They also take care of all sorts of neurological conditions. So having a movement disorder specialist, they are doctors that specialize in Parkinson's, and a lot of them do research. So that's what we recommend people go to, is see a movement disorder specialist. Another thing, a term that you'll hear is bradykinesia, which means slowness of movement. So maybe if it takes you 10 minutes to get ready in the morning, now you get this diagnosis because it was taking you an hour and a half to get ready, and your partner said, oh, you're taking so long to get ready. That can be a sign of Parkinson's. Another thing that happens is dyskinesia. That's a term that talks about uncontrolled involuntary movement. So you, Michael J. Fox, who moves around, that's from the medication side effect when he has to take too much medicine. It's not the actual Parkinson's. Dyskinesia is uncontrolled involuntary movement. Dystonia is another term. It's uncontrollable contractions of the muscles. So some people have cramping in their muscles, not everybody, but that's something that that the doctor may say you have. Dysarthria is slurred or slow speech. So that's another one. And micrographia, that's small handwriting. So I bet a lot of you had, you were diagnosed, one of the symptoms you might have noticed when you look back on it is that your handwriting was more difficult to read. That you start out with big letters and then it gets smaller and smaller as you go, and then you can't even read your own handwriting. So that's another terminology, the micrographia, that the doctor may say. And masking is another one, which is a loss of facial expressions. So your muscles in your face aren't working as well, and your eyes are not blinking. People with Parkinson's blink once in a minute. People who do not have Parkinson's blink 10 times in a minute. So this masked look that comes across, the doctor may talk about that too. Another term that you might hear floating around is DBS. Now that's deep brain stimulation. It's a surgical treatment that's best used for tremor, and I'll go more detail with that. I'm just giving you the terminologies. And carbidopa, levodopa, that is cinnamon. That's the main drug that people take for Parkinson's, standard drug that's been around since the 60s. They call it the gold standard, and people take that. So I will go into more detail about medication too. You will have a doctor in the next session that will talk more specifically about medications. Okay, next, please. Okay, so some facts about Parkinson's. There's no standard diagnostic test that usually through clinical diagnosis to say you have Parkinson's. So initially when I said that you go to your primary care doctor, that about 50% of people will go to their doctor to get a diagnosis. And then 70% of people go to their go to a neurologist, maybe to ask your PCP for referral to a neurologist. And then after seeing a neurologist, 90% go on to see a movement disorder specialist. So that is kind of how things flow. A lot of people go see their PCP, who then said you need to see a specialist. It's a 2-to-1 ratio of male to female who get Parkinson's. It's more tremor dominant versus non-tremor dominant. And what I mean by that is a lot of people have the shaking, and some don't have that symptom at all. Young onset, this is a typo, that is when someone has been diagnosed with Parkinson's before the age of 60. And so that's when you hear so Michael J. Fox, who's willing to be literally a poster child for Parkinson's, he was diagnosed in his late 20s with Parkinson's. And he was, because of him being diagnosed, the first 10 years, he didn't tell people except his immediate family that he had Parkinson's, and was drinking a lot. And his wife said, you know, you need to do something about this because you're killing yourself by drinking and anger with this. So they started the Michael J. Fox Foundation. And with that, he is literally on a poster of him, and it's made up of individual people like you. So who's representing everybody who has Parkinson's. So it's estimated that there are over 1 million people with Parkinson's in the US, and approximately 17,000 are in Colorado alone. And the total cost of Parkinson's nationwide is $52 billion. So where that money is added up, and the Parkinson's Foundation has that information, is that the national, but it goes by Parkinson's Foundation, that that total, it's from medications, it's from physical therapy, occupational therapy, speech therapy, counseling, the medications that cost a fortune. It also is if people need to go to an assisted living down the road. So those are what I wanted to tell you about that. So so I'm going to tell you, do you want to turn to the next slide, please? So there was the one, what is, go back one more if you can. No, back again. We did the terminology facts. Okay. Okay, so let's go to the next one. Okay, so there's different stages of Parkinson's, and I'm just going to tell you these, and then we'll talk about it further. A lot of people ask me, what stage am I in with my Parkinson's? And you know, a lot of the doctors and researchers kind of want to give you a guesstimate of where you're at. Most of you are probably in the early stage of Parkinson's. So your symptoms are mild, and that means that they're usually seen on one side of the body. So if you have the tremor on one side of the body, that's about it. And some people think that is, it's no big deal. Others who maybe their profession is, they're an architect and they have to be really, really right on with what they're doing and be very meticulous in what they do, and they have tremor, maybe it's predominantly in that right arm and their right hand and they're right-handed, that can cause it to make them feel like it's moderate, because for them it means a lot that they're having these problems. So so these different stages are different, what they mean for people. They're unique to each person. So I always get, the number one question I get is, what am I going to be like? And the doctors can't tell you, God can't tell you, I can't tell you. What we can do is stay ahead of the curve, and a lot of our programs that the Parkinson's Association puts on are things for ahead of the curve, so that you will be able to stay ahead of things. So our last one is on exercise in our sessions, and that is the key for people to lots of exercise will help them with hopefully not progressing into further symptoms. So the second stage is mild symptoms of both sides of the body, so bilaterally involuntary movement. So it could be also some rigidity, some stiffness. And then the third is more moderate. Symptoms of PD are characterized by loss of balance and slowness of movement, so that bradykinesia. And hopefully we're going to keep you from getting to any further in these symptoms and stages by staying ahead of doing different things for yourself. And the exercise programs that we offer are great to help with balance and help with your movement. And then stages 4 and 5, those are what we call severe advanced PD. And this is, since this is PD 101, I don't want to scare you, so we're going to move on. That's when they have more severe issues with Parkinson's. So let's move on to the next slide. Okay, so you're given this information, you have Parkinson's. So what causes Parkinson's? They don't know. There is, and this is really frustrating for you, for me, for the doctors, for the researchers. I do not have Parkinson's. My dad had Parkinson's. I was working for PAR, the Parkinson Association, the Rockies, PAR for short, for 3 years, and I noticed some things with my dad, that he was slower in his movement and his balance was awful. I had him go see a movement disorders doctor and he was diagnosed with Parkinson's. So should I worry that I'm going to get Parkinson's? Probably not. You know, there are some mutated genes. There are 4 that they've recognized, researchers, that, and so if my mom had Parkinson's, my aunts had Parkinson's, if I had a sister and she had Parkinson's, and going down the line, then there would be a strong chance I could get Parkinson's. Doesn't mean that I would get it though. Only 10% of people that have inherited Parkinson's genes, mutated genes, get it. So if you were just, since you were just diagnosed with Parkinson's, hopefully your family, you know, if you have children, will not get it. And if your parent had it, then there's still a low chance of them, percentage of them getting Parkinson's. So that's genetics. Let's take a breather for a minute, and I'm gonna then talk about environmental. So I want you all to breathe. Breathe in through your nose and slowly out your mouth, okay? Okay, so environmental exposure, that's another possible cause of Parkinson's. It's a factor. So if you grew up in a rural area, let's say where there was a farming community and they're spraying overhead and people, there's lots of pesticides, then there's a chance you could get Parkinson's. But why is it that in Bennett, Colorado, which I've gone to work with people, there were 3 people that I knew, met with, who had Parkinson's, one in his 30s, one in his 60s, and one in his 80s, who were diagnosed with Parkinson's, and they were spraying overhead. But why is it that only 3 in that community diagnosed with Parkinson's? So they were exposed to something. Pesticides are in their rural community. Some people have grown up around well water that have a higher concentration of manganese, and that can cause some people to get Parkinson's. But why is it that 9 out of 10 or 9.9 out of 10 didn't get it, but the 1 person did? Prolonged exposure to chemicals can happen. So if you developed your own film, there are some people in that profession who get Parkinson's. Some artists who use oil-based paints have developed Parkinson's, but most people do not. Agent Orange is a big one. Our vets that were exposed to Agent Orange in Vietnam. When I first started with the Parkinson Association 23 years ago, the VA did not acknowledge that Agent Orange was correlated with people developing Parkinson's. As the years went on, more and more of their vets who had Parkinson's had been exposed to Agent Orange. So if you were exposed to Agent Orange and you're a vet, they will pay for 100% of your care. So that is a good thing. And so if you have questions about that and going about that process, you can give me a call and I'll give my number again at the end. But these are some of the environmental exposures, okay? So there's the rural communities, exposure to pesticides, well water, prolonged exposure to chemicals, and Agent Orange. So those, so then you've got, there's a combination that they think that it's caused by a combination of environmental factors and genetics, but most don't have any connection at all. So that's what the frustrating thing is about Parkinson's, is that they're not exactly sure what causes it. And so one of the big deals, that the reason why they can't find a cure for Parkinson's is they need volunteers to be in research studies, and I'll give you that information at the end. Okay, thank you. Next. Okay, before we go on with this, I'm gonna ask Annie if there are any questions that people have right now. There's a lot of information I've given you so far.
As of now, no, but you can raise your hand or type in the question box if there are any questions up to this moment.
Okay, and to give me some feedback, has this been going okay for you? Is it helpful? Do you want me to change how I talk to you? Just, I don't want to go through the whole thing and then people say it should have been different. So any other comments? Okay, so I'm going to go over signs of motor symptoms. So these are primary symptoms used in the clinical diagnosis of Parkinson's. So then you'll see a lot of people say that they go to the neurologist who watches them walk down the hall and come back, asks you about what your symptoms are, and then if it's a good doctor, a movement disorders doctor, usually will spend an hour with you that first time you go to see them. The general neurologist does not spend as much time. And the way healthcare is today, I really recommend you see a movement disorder specialist who will give you more time. They'll watch you do all these different things, do different tests to see. They'll watch you touch your finger to your nose. When you sit, do tapping your feet on the ground to see how fast you're doing it, all sorts of things. And they'll look at your face. When I mentioned the masked look, meaning that your face doesn't have the motor function in your face to show smile expression, and maybe have that masked look where your eyes are staring, the doctor can diagnose you as having Parkinson's. So a lot of people say, gosh, you know, I was only there for 10 minutes before they diagnosed me with having Parkinson's. What's up with that? Well, that's why if specialists know what to look for. So they're looking for if you have a tremor. Not everybody has tremor. Some people call it shaking. Some people have a little bit in their hand, maybe the other one, or maybe in their foot. It might start out as the thumb and then the fingers, and then move up the arm and then the other. So when you're walking and they walk, you just aren't symmetrical with your walking, and that's asymmetrical arm movements. So when you're walking down the hall, it's not going up and down, right, left. So they're looking at that. They look to see if there's rigidity, which is stiffness. When they do to check your reflexes and they don't move as quickly, that's something they notice. They'll notice, like I mentioned, bradykinesia, which is slowness of movement. So maybe when you're going to sit down, it takes you like your slow motion, or when you go to stand up, it's real slow. And, you know, the doctor asks you about how long it takes to get ready for the day, and the partner says, oh, it takes her an hour and a half to put her makeup on, or it's hard to brush the teeth, or it's taking a long time to eat food, to get it up to their mouth. So those are some things that the doctor will take note of. The postural instability. So balance could be an issue that someone is having. Not everybody has all of these symptoms. They may just have one or two. So these are some primary symptoms used in the clinical diagnosis of Parkinson's. Okay, next slide, please. So do you want to go back one more? Sorry. So some other motor symptoms include dysarthria, which I was talking about before, soft voice. So when you're talking, maybe your wife doesn't know, or your husband doesn't know that you're talking. You think you're talking in a regular tone voice, but the vocal cords aren't going together closely because of that slow movement, and the diaphragm isn't pushing the air out to make you talk louder. So that might be one of the symptoms people have. The masked look, the small handwriting, and difficult swallowing, and freezing. So these are some of the, and what I mean by freezing is when you get up to walk and you can't move, or you go to lift to get the phone, your cell phone, and you're kind of stiff like a statue because you're not getting the signal from up on top to your arms, to your legs. And so people, they call it freezing. That's not a permanent thing. It's very concerning for people when you have that, because when we get up to walk, we don't think about that. We don't think about having to move each leg 1 foot at a time. We don't think that when we go to grab the phone that you're going to have a problem with that. So there's different ways to treat freezing. And one of them is to distract yourself. So not to worry about what's happening, which is really hard not to do. Look out the window, look in your environment around you, use your senses. So think about what it looks like outside. In our climate right now, it's very hot. So can you feel the sun on your skin? If it's cold, you feel that it's so cold that your body is really cold, and it's hard. You need to put on gloves or something. But right now with our heat in the summer, we think about using our different senses. What does it look like outside? What does if you still have your sense of smell, what does it smell like, the dinner that you're going to have? Think of your favorite food. That tends to help, and go really detail about what your favorite food is. Let's say it's ice cream sundae. You have you have chocolate sauce on it, and so visualize that, and that'll distract you from having to help break the freeze. So what happens is that sometimes we need to have a distraction to break the freeze. So at the Parkinson's Association, we have equipment loan program where you can borrow a U-step walker if you needed that. And that has a little button you push on it, and then a red beam comes down in front of you, and then you step over it and go on your way. So say similar thing. So I always like to talk about your favorite food, because that makes you happy and relaxed, and makes it easier for you to get through that issue. Not everybody has freezing, not everybody has difficult swallowing, and not everybody has a soft voice. So I'm just giving you the different signs and symptoms so that if you have those issues that come up, know that you can be helped with that. There's different therapies that can help you with that. Okay, next, please. So non-motor symptoms. A lot of people, like I said earlier, they lose their sense of smell before they're diagnosed. It could be years before. And when looking back on things, they think, I really had this problem with smelling, and maybe that, or my handwriting was really small. And so they're looking at, which is a motor symptom, but this loss of smell can also be from pre-diagnosis. A lot of people have sleep apnea. And with that, there's what we call REM sleep disorder. which is pre-diagnosis. A lot of people have that and have to wear a CPAP machine at night. That's pretty high in people with Parkinson's. What happens is that when, like I said, deep in the brain is where the substantia nigra is, and right next to it is the sleep center. And that sleep center, when we're in deep sleep, in REM sleep, it tells us, those of us who do not have Parkinson's, it tells us to not move. People who have Parkinson's do not get that signal, and so they tend to move a lot in bed. Men, research has proven, tend to throw their fists around and scream out loud, cursing and things that are really scary for the partner. And women tend to sleepwalk when they have the REM sleep disorder problem. So you'll talk to your doctor about that, because it's important to let them know about if you're having some sleep issues, and they can help you, give you a plan to help with that. So I mentioned the sleep apnea, and then there's restless leg syndrome. Some people have that where they're not getting the signal not to move, and so they're moving their legs around. And some people have that pre-diagnosis. A lot of times people have constipation because, like I mentioned, everything moves slower. And so people who have even the inside of our bodies going through the intestines, everything moves slower to come out. People with Parkinson's tend not to drink enough fluids, because what happens when you drink a lot of fluids, you have to use the restroom. And then if you go fast to get there, and if you're having balance issues and you're walking slower, some people have accidents. So they don't drink enough, and they can get constipated. And medication can cause that. So I don't want to give you gloom and doom. I'm giving you different things that can happen, but we're going to stay ahead of that by giving you information on how you can try to stop getting constipated. So drinking plenty of fluids, and eating foods that are rich in fiber. Some people have issues with eating dry food like toast or crackers. So I want to make sure that you have don't eat that, and you can eat foods that are rich in fiber and have plenty of fluid on them too. So gravy or that sort of thing. So bladder habits change. People with Parkinson's don't get the signal from up top to the bladder to have to go at a certain time. So what happens is you don't get the signal. So your bladder is filling up with liquid, and it gets to a point where it's so full that it's like a balloon, a water balloon. It pops, and then people lose the ability to make it to the bathroom in time. So you talk to your doctor about setting a schedule of how often you go to the bathroom. Some people have excessive or low sex drive. So some people, when you're on one of the medications that'll be talked about with Dr. Sauls Cohen at the next meeting, are on dopamine agonists, which are drugs that help act like dopamine but don't convert into dopamine, and they affect the frontal lobe of the brain, where our inhibitions aren't there. And so some people then will want to have sex all the time with that one. So you'd have to talk to your doctor about that. Some people don't have a high sex drive anymore because they're feeling depressed about this new diagnosis and what they look like, and what if they can perform or not. And I can help you, talk with you. It's all confidential, can share information with me, and I can help give you some ideas of what you can do to make it so your intimate life is good. Another thing is orthostatic hypotension. And what that means is that when you get up to stand up to get going, and then you get dizzy and you might want to fall over, that means that your blood pressure plummets. And that does not happen with everybody. So with that, your doctor can help you, and I can help you too. These are different symptoms that can happen, but I want you to remember again, you're going to be okay. So remember, you're going to be okay, because there are ways, tools to help you with that. One of them for the orthostatic hypotension is to have Gatorade, like Gatorade 2, which doesn't have as much sugar, so higher in electrolytes, that can help you keep your electrolyte balance higher. When you get up in the morning, you get up slowly and breathe, deep breathing, and you could have nuts by your bed if you're not allergic to nuts with salt in them. That'll help elevate your blood pressure if you don't have high blood pressure. Another one is non-motor symptoms is swallowing difficulties and drooling. So drooling can happen when people are having a difficulty swallowing, and so they're pulling the fluids in their mouth. And so how that can be treated is eating bubble gum, sucking on sour candy, and swallowing difficulties. I will talk to you if you have issues with that. I don't want to overwhelm you, but these are just some of the symptoms that can happen. Some people have excessive sweating, skin changes, where people with Parkinson's have a higher incidence of getting melanoma. So always wear a hat, and we're in high altitude climate. So regardless if you have Parkinson's or not, you should wear a hat and have sunscreen on. Some people have vision problems, and you would see, I can give you information to see a neuro-ophthalmologist in town. We have some good ones. Cognitive changes, some people have problems thinking clearly, and some memory issues. And these are things that could, but don't always happen. And mood changes, anxiety, depression, and apathy. So having anxiety and depression right now is very common because this is a new diagnosis and you're not sure what lies ahead for you. Know that I can help you on this journey. And some people develop depression and anxiety. It's an organic cause for Parkinson's. So if you have a history of anxiety and depression, it can be getting worse. So talk to your doctor about it and they'll help you with that. Another big thing that happens with people with Parkinson's, a non-motor symptom, is apathy. So apathy means that you have every intention of getting something done, but it just doesn't happen. And the one consistent thing about Parkinson's, it's inconsistent. So people who have Parkinson's tend to, maybe they took the trash out this week and then, or they take it out every night, you know, from the kitchen to the garage and there, wherever you put your trash. And maybe do it 3 days in a row and you just don't do it. Or if your partner asks you to do the dishes and you normally do it and you just didn't get around to it. If you have every intention of doing something, but it just doesn't happen. So that can cause some issues for partners, is that you know, how do you know what that person's going to be like any given day? So know that having the apathy doesn't mean that's who they are, and they're not trying to get you angry, that it's literally a organic cause of Parkinson's. Another thing, like I mentioned before, there's sleep changes with the REM sleep disorder, and some people, when they take their medication, don't sleep as well. And then when you have the REM sleep disorder with not sleeping well, the next day you're exhausted. Medication can also cause fatigue, and if you have tremors, that can also cause fatigue. So tremors, you may not have them externally, but some people feel like they're jittery, that they just drank a gallon of Mountain Dew or a gallon of coffee and are wondering why they're so jittery the next day and they're so tired. It's because it's like you're on a treadmill 24 hours a day, 7 days a week. So that's another reason that can cause fatigue. Okay, next slide, please. So now what you want to do, that you have this team, you need to build a team. So you have a lot of support around you. Whether you have a close family relationship and friends, maybe you don't have a large family, maybe you don't have a lot of friends, but you have your community. PAR is very much there to help you through this journey. We have support groups throughout the state, and you may not want to do any of that stuff with PAR right now, because I want you to enjoy you for being you, and don't have the PAR written across your face or Parkinson's and it's beaming lights that you are Parkinson's. No, there's so much more to who you are. Maybe you're retired, and I always want to know what you did for a living. If you have family, what do you like to do? Do you like to travel? And hopefully you'll still be able to do those things. So the community is there for you. So rely on your family and friends. Explain to them that this is not a contagious condition, and and explain what Parkinson's is. And they'll, a lot of times people are afraid to ask you questions. Let them know if and when you want to talk about it. Some people who are still working don't tell their employer, and that's okay, as long as your job doesn't could cause issues. I had a gentleman who was a conductor of a light rail train, and he had his reflexes were slower, so he couldn't stop the train in time. So so for him, he could do something else with RTD, but not be in charge of a light rail. I have another gentleman that was a painter. He painted outside of houses, so he'd get up on the ladder. Well, he had balance issues, so that wasn't safe for him to do. So that would be important to talk to his employer about that. But really, we all have something, and so it's not necessary where you have to tell your boss that you have Parkinson's. Spiritual advisors, this is your social team. And so if you are affiliated with the church, synagogue, whatever, they're there to help you too. And the community that you belong to, they're there to support you. If you want to share that information, you're welcome to do that. There's the medical team. There's your primary care provider, and usually, or they have PAs that help, the nurses, so they are all there to help take care of you. There's the mental health providers that can help you. You can see a counselor, a therapist to help you deal with coping with a new diagnosis. There's the movement disorder specialist, who is your doctor. Hopefully you are going to be seeing a neurologist that specializes in Parkinson's. You have rehab specialists. So those are physical therapists, occupational therapists, and speech therapists that are specialized in Parkinson's that can help you with all along the way. So they all recommend that you have a baseline so they can help you once a year as things change. They can redirect you for different kinds of exercise programs that you can do. They recommend that you see all of those right now so that you get kind of a baseline for what you can do for yourself. And then there's the social worker, myself, that can help you, and our staff are all great, and we can help you with, we have Annie helps with our different programs that we have, and we're having the E3, that's on September 10th, that's free, and it's a great program that we have once a year. We have lots of people that come to it, and you can also do it virtually. If you can go in person, that'd be great. And that has other people that inspire you, enrich you, educate you, and it's a fun thing. So I want you to know this is definitely a PD 101 educational class. I want you to do something for yourselves when you leave here today, and outside of Parkinson's. So right now it's overwhelming, and it's kind of taking control over you, but I don't want it to continue to do that. You're learning, you're educating yourself about Parkinson's, which is a great thing. And you know, ignorance is bliss, and knowledge is powerful too. So allow yourself to take a break from Parkinson's. What does that mean? Yes, you need to if you need to be on a medication, then you need to follow what the doctor tells you to do. Ask questions, be an advocate for yourselves. That's a big deal. Unfortunately, in today's times, we have to really push to get answers from our doctors and the PAs and the nurses. So make sure that you ask for help. You don't have to do this alone. So like I said, building your team, it's really important to rely on other people to help you. Okay, next, please. So these are some resources. I think Annie has given it to you, that are different organizations. The Parkinson, it's called Parkinson Foundation. It's not national anymore. But the Parkinson Association of the Rockies, that's us. It's parkinsonrockies.org, Parkinson singular, then Rockies is plural. And we have lots of information on our website. You can call the office if you have questions. You can call me at the number's 303-861-1810. The Davis Finney Foundation. Davis Finney is a athlete who was in the Olympics. He's a cyclist, bicycle, and he was diagnosed with Parkinson's. He lives in Boulder, and he started an organization that works on exercise. They have a book. You can call them and that number and ask for Every Victory Counts. It is a booklet that's about an inch thick that has tons of information. The Parkinson's Foundation has a lot of information, and the Michael J. Fox Foundation has a lot of information about Parkinson's. So when people say that they were given a diagnosis of Parkinson's, what do I do now? They go and look on Dr. Google to get information. Well, Dr. Google doesn't always have the right information. And I know people are going to look, but you should, to be educated. And you joined today because you wanted information about Parkinson's. So why don't you look at these websites? They're the ones that have lots of information for you. And some of them even have videos. The Michael J. Fox does, and so does the Parkinson's Foundation. And then have Davis Finney send you their foundation send you the book on Every Victory Counts. So that is a lot that I provided for you today. And so what I want you to remember is you're going to be okay. And whatever okay means will help you through that journey that you didn't choose to be on. Know that this is not a contagious condition. There's treatment for it, and the doctor will talk about the different drugs the next time, so I'm not going to talk about that. So if we all have some questions, I'm here to answer them.
So, Michael, I'm going to unmute you because you typed in the question box, but I'm not sure what your question is. So let me unmute you, and then we'll go to Paul, who also has a question. Michael, I sent you an unmute request. It should come up on your screen.
Annie, I was able to see Michael's question. He was just responding that we could hear Cari okay.
Oh, okay.
Yep, so Paul's got his hand raised.
All right, perfect. Paul, you're unmuted. try it again.
And Paul, you may need to unmute yourself. So we've unmuted you, but you may be muted on your own system.
If not, Paul, you can try to type in your question in the question box if the microphone's not working.
And I'm really sorry for the technical problems here today. I know it's tough when you want to. Do you have the, are you on, Paul?
Paul, I also sent you a private message through the chat. If anything, you can always try to respond to my message with your question.
Okay, so I want to tell you another thing while we're waiting. The freezing, when we talked about that, you know, some people respond by visual learning and others by having by oral. They learn by listening to things. So what you might try to do if you're having freezing problems is to count where you're supposed to be going. 1, 2, 3, 1, 2, 3, or sing to yourself or sing out loud, happy birthday. That tends to help people break that freeze that people are having.
So, Cari, we do have one question from Gina. She said, was that $52 billion figure for cost of Parkinson's per year?
Yes. Yeah, because that adds up for because people are living in assisted living facilities. That adds up to that. Yeah.
Okay, it seems like Kevin has a question. Kevin, I'm going to unmute you. And
oh, hopefully you can hear me.
Yep.
Hey, Magic. You talked about the neural ophthalmologist.
Yes.
I was very recently diagnosed and noticed in discussion during the Q&A that my vision's gone downhill somewhat. I'm just trying to work out the process between determining if it's just regular good old failure or Parkinson's causing the decline.
So are you having problems with your vision? Or...
Yeah. Yeah, it's getting worse. In an accelerated manner, like previously we just go down, very minor prescription change, but now I'm wearing glasses to read a lot.
Okay.
Which I suspect is related.
Well, how old are you? Yeah.
66.
Okay. Usually when we turn 40, we have some problems with reading close up, but it could be that I'm not a doctor, but I've been doing this a long time, that a lot of people have the dry eyes that can cause some vision problems because you're not blinking as much. And excuse me, and our climate is dry. We don't have humidity here. So that could be an issue for some people. You may want to see a neuro-ophthalmologist. And did you go to your regular eye doctor? Have you seen them recently?
Well, I was about to, in fact, I made an appointment to see them, but then in this discussion, if there are specialists who deal with Parkinson's impact, then it may make more sense to go there instead.
Yeah, I would go see your regular doctor first, your eye doctor, and then if they notice some issues from just generally your vision getting worse, then that may be an issue. Some people with Parkinson's have, if they don't usually have their vision getting worse quickly, it could be the dry eyes, and it could be some people have blurred vision or see triple 3 times the amount of people standing right there. And then they have to have like hourglasses put on their glasses. I would see your regular eye doctor who you've seen for a while. And then if you can get in soon, if not, give me a call, or you can go to my website here, or my email address, which is cfriedman, FRIEDMAN, at parkinsonrockies.org.
Sounds good. Thank you.
Yeah. Yeah,
Here.
for sure. No, we don't have my email on there. Need to put that on. But yeah, so yeah. And like I had mentioned earlier, that you think that everything you have is related to Parkinson's. My guess is maybe it could be that you have dry eyes, and because of the not blinking, that could be causing some problems, and that may be related to Parkinson's. It may not. So it could be that your eyes are getting worse just because they're getting worse.
All right, it seems like we have a question from Keith. I'm gonna unmute Keith. Go ahead.
Okay, can you hear me?
Yep.
Great. So on basically like a restless RLS, restless leg syndrome, or these our legs move, get into motion all the time or quite often. Is there a way to shut that down?
Yeah, so you're having what when you're awake? Are you taking medication for your Parkinson's yet?
Yeah.
Okay, and did that start once you were taking the medication?
I believe it's gotten worse. I think I had some of it. It's been a little bit of a process, 4 months or so, trying to dial it in. So I've been on different medications.
Yeah.
And, I mean, some days are worse, some days are better.
Okay, so like I said, the consistent thing about Parkinson's, it's inconsistent. So some days you might have your legs moving around. I don't know, you'll have to ask, who's your neurologist?
Dr. Barmore,
Okay. And where does Dr. Barmore practice out of?
Greeley and Loveland.
Okay. So is Dr. Barmore a movement disorder specialist?
Yeah, yes.
So, yeah, so I would check with Dr. Barmore to see if it's related to your Parkinson's. I don't know if it is.
No, that's not really what I'm asking. I'm asking it when is there a way to kind of get it to subside?
Yeah, yeah. So to get it to subside, the legs movement, try to distract yourself. When it's happening, don't focus on it. Kind of do some relaxation things. I know it sounds silly, but that deep breathing, there's no side effects with that, and there's no it doesn't cost anything. There's not a copay for breathing. So,
Yeah.
so try to do some breathing, not focused on that, and distract yourself by either watching a show you like on TV, or if you like the Broncos, they're going to be starting, just different things. Go for a walk, kind of move your position so that it's, if you're sitting when it's happening, stand up and walk and do some exercise maybe. That can help with that too.
Exercise is huge.
Yeah.
But I got to take a break every once in a while.
Absolutely. You can't be on the treadmill. You can't be riding a bike 24/7.
Right.
Yeah, and I'm sorry that you're going through that. It's exhausting to have that. Is it painful when you're having it?
Yeah, yeah, kind of, yeah. I mean, yes, yes, it is.
So that's why I suggest you talk to the doctor about, I don't know what medications you're on. And it could be they may have to adjust that. You know, one of the big hurdles is being diagnosed with Parkinson's. Because like I said, there's not a test that can say, yes, you have Parkinson's. There's a DAT scan, which is an expensive test that can look at the levels of dopamine in your brain. And it's not as reliable. So a lot of doctors don't use it. But other than that, they do tests to rule out. So an MRI can show if you have, so if one side of your body was moving, but the other doesn't move as much as the other one. So they want to look to see if you've had many strokes, and that would come up. Or if you had a brain tumor, that would come up on a scan, MRI. But then they look at that if there's not anything, then they say that, oh, you don't have those conditions. So then it probably is Parkinson's. So that's the first hurdle. And then it's to find a doctor that works for you, a neurologist, a movement disorder. And then the third hurdle, a big one, is finding a medication that works for you. And the doctor will talk to you about that next time. But medications are really hard to get to work for people. Some people, they take too much of the medicine, which can cause the dyskinesia, involuntary movement. I don't know for you if it's just the legs that are moving, what else is going on. So they have to tweak medications. And for some people, they'd rather not start on medications early because it can cause side effects. And she'll talk to you about it next time. But so the symptoms, if your symptoms are worse than taking a medication, then take the medication. If the symptoms when you take the medication are worse, then maybe don't take the medicine. So does that make sense to you guys?
Yeah, I just do whatever the doctor says.
Well, I think, you know, you can use them to help guide you with the medication. But ultimately, you're not going to OD on the medication for Parkinson's. It can cause side effects, but meaning the involuntary movement, and you're having it in your legs. So I don't know what's going on with that.
Yeah, all
Yeah,
my
check
stuff in my lower torso.
I don't think it's an urgent thing. You're not gonna, it's not meaning that your Parkinson's is getting worse quickly. And for the last person who was talking about with the vision, it could be just a slight thing that they need to correct. Right now, you guys are under a microscope with thinking all this is related to Parkinson's, and some of it may be, and some may not be. So, but it's good to get checked by your doctor.
We have one question from Christy. I'm gonna unmute you, Christy. Go ahead.
Hi, can you hear me okay?
Yep.
Oh, okay. Well, you know, with there being so many symptoms with Parkinson's, how can you tell when something really is related to Parkinson's, a symptom is related to Parkinson's, and when it's not?
Yeah, that's a good question. So how do you know when a symptom's related to Parkinson's and when it's not? Well, if you're having, and you sound young to me, if your symptoms are something new, and you went to a doctor because you thought things were going on that don't normally go on for you, then, so what, can I ask why you went to the doctor? What sort of
Well,
symptoms?
I'm 60, and I was just diagnosed a couple months ago with Parkinson's because I had the tremors in my hand. They, you know, first tried the meds for tremors. That wasn't working, and so I did go to a movement disorder specialist, and he did do all the tests and confirmed that it was Parkinson's. So, you know, I've haven't had a sense of smells for almost 15 years and other things. And I'm just starting to notice things like, my legs will one day will just be more weak, more wobbly, and then kind of tingly that day, and so I don't know, okay, is that just I'm more tired that day, or is that something that's Parkinson's related?
It could, well, when you were tired earlier, before you were diagnosed with Parkinson's, and you've had the symptoms of the not being able to smell for 15 years, so that might have been the beginning of your Parkinson's. So
Yeah.
I think what's happening is that now you're under a microscope where you're looking at every little thing that this might be related to Parkinson's. So try not to, I know it's hard to do, but try not to think everything that's happening to you is related to it, because that's going to drive yourself crazy.
Yeah, definitely. Yeah, well, thank you.
When you're outside and if you get really lightheaded, maybe you weren't enough liquids and it's hot outside, that's not related to Parkinson's. That's related to not being hydrated.
Okay. Okay, thank you.
You're welcome.
Is there any other questions before we finish today?
Okay, so I want you guys to remember, there's a couple things to remember. One, you're okay. Just use the 2 letters, okay. What does that mean? It's different for each person. So if you're having vision problems, one person might be having them, but that doesn't mean everybody else is. Your vision problems may or may not be related to Parkinson's. Your different symptoms that come up, if they're problematic for you, get in touch with your doctor. Okay, so if you're having your legs moving around, grooving, and they're just driving you crazy, then you talk to your doctor, because that's not normal for you. If you go outside and don't have sunscreen on and you develop a melanoma, that's because you didn't, in our climate, it's easy to get a melanoma. People with Parkinson's they don't know why, but there's a higher chance of getting a melanoma. So wear a hat, and then go about your life. I mean, it's not that big a deal to wear a hat when you go outside. If you're having problems with swallowing, I want you all to see a speech therapist. They look at swallow as well, and just to get a baseline, to be ahead of things, or ahead of the curve, to figure out if there's something you need to work on, and exercise. That's going to be a motto for you. It's healthy for us to exercise anyway. People who have Parkinson's, it's important to exercise to help with mobility and strength. So those are the few things I want you to remember out of this. And I gave you a general overview, a lot of detail about the different things that could or may not even happen to you, but know that those are things that are out there that relate to Parkinson's. So if you have questions, further questions, please feel free to email me at stevefriedman@parkinsonrockies.org or call me at 303-861-1810, and I'm happy to talk further with you guys.
Cari, we have one more question from Diane, and I have also put Cari's email in the chat box.
Okay.
I'm going to unmute Diane. Go ahead, Diane.
Hello. I'm wondering, are you going to be sending out this presentation, the PowerPoint that you're using?
We can do that.
We are also, this is recorded, and we're also going to be posting this on the Parkinson Association, the Rockies YouTube channel. But if Cari's okay with it, I can email this presentation.
Sure. Yeah, good question. Sure. There's a lot of information. I've done this for a number of years, the PD 101, and I've wrestled with if I should give out all the information or not, because I don't want to scare people. But the feedback I've gotten is people want to hear that information. There's different It's an umbrella of Parkinson's, different symptoms and severities. Right now, I think that you all, by participating in this is going to help you to keep your lives going ahead and happy. So I appreciate all of you participating and asking questions, and continue to ask